Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. So today we are going to present the topic on infertility, and one of its treatment is intracytoplasmic sperm injection, which is ICSI. And meet our group members, which is Salihah, Balkis, Fatimah, Natasha, and Wafa.
This graph shows us fertility rate in Malaysia. As we can see, undoubtedly there has been a decreasing rate of fertility in Malaysia. For instance, in 2011, the fertility rate was 2.15, but by 2021 it had decreased significantly to 1.80. This demonstrates a substantial decline in just a decade. So, one of the factors contributing to the decreasing fertility rate is infertility. This happens because not all individuals who experience infertility can afford fertility treatment in order to conceive. Although decreasing fertility rate has various other factors such as the usage of contraception and high living costs and economic, it is crucial to highlight that infertility is one of the significant factors that lead to decreasing fertility rate. So, what is infertility? Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more irregular unprotected sexual intercourse. News update. Although Malaysia does not have official statistics on its infertility rate, there has been an obvious increase in the number of couples who are unable to have children despite being married for several years. Gynecologist Dr. Azirawati Muhammad Tazri said, nowadays it took people more than a year or two to conceive. Next is male fertility problem. The first one is azoospermia. Azoospermia is a medical condition when there are complete absence of sperm in the ejaculate. On the other hand, oligospermia is characterized by a low sperm count in the ejaculate. According to the World Health Organization, a normal sperm count is typically above 50 million sperm per millimeter of semen. So, men with oligospermia has lesser sperm than that. The third one is abnormal shaped sperm. Normal sperm typically have an oval head with a long tail that allow them to swim effectively. In this case, the sperm may have defect in the head, midpiece, or tail that affect their ability to fertilize an egg. Female fertility problem. The first one is irregular ovulation. Irregular ovulation can make it difficult to predict when ovulation occurs, which will complicate the effort to conceive. Next is blocked fallopian tube may prevent the sperm from reaching the egg. If fertilization does occur, the blockage in the fallopian tube can prevent the embryo from reaching uterus. The last one is problem with the uterus. For example, fibroid that bulge into the center of the uterus can make it more difficult for an embryo to implant into the lining of the uterus.
Factors that can lead to infertility. There are many factors that can cause infertility no matter in what gender. Let's look at men first. Some of the factors that I include here are habits and also drugs. I purposely chose these two bad habits, which are smoking and drinking alcohol, as these two were very common for men. Excessive smoking, it could damage the DNA in sperm and reduce the sperm motility. Drinking alcohol excessively, it could lead to decreased sperm product and testicular shrinkage. Drugs have two types, which are medicinal and harmful, but abusing the taken amount of the drugs toward ourselves may lead to infertility, such as steroids. It may reduce sperm production and cause testicular shrinkage, while overdose antidepressant drugs can affect libido, erectile function, and disturb the sperm quality. Now, let's move on to factors that lead to infertility in women. Some of the factors are diseases, habits, and also medication. For diseases, some diseases can spread through intercourse, such as chlamydia and gonorrhea, and these diseases will cause infertility in women. Bad habits. These are some of the bad habits that can lead to infertility, which are poor sleep habit and caffeine overconsumption. Poor sleep habits can disrupt hormonal balance and menstrual cycle, and caffeine overconsumption. Based on some studies said, women may take longer to become pregnant and may have a higher risk of miscarriage. For medication, some unfortunate events that may occur, such as accidents. There are some ways or medication steps to heal them, but the steps may cause infertility, such as chemotherapy drugs. It can damage the ovaries, leading to reduced fertility, and removal of reproductive organs, such as uterus.
Let's take a look at the procedure of ICSI. Firstly, ovarian stimulation. Before the procedure, the woman undergoing treatment typically undergoes ovarian stimulation to produce multiple mature eggs. This is often done using hormonal medications. Secondly, the egg retrieval. Once the eggs are mature, they are retrieved from the woman's ovaries through a minor surgical procedure called transvaginal oocyte retrieval. This is usually performed under sedation. Third, the sperm collection. On the same day as the egg retrieval, a semen sample is collected from the male partner or a sperm donor. If the male partner has a low sperm count or other sperm issues, the sperm may be retrieved directly from the testicles through a procedure called testicular sperm aspiration, TESA, or testicular sperm extraction, TESE. The fourth step is preparation of sperm. The sperm sample undergoes preparation in the laboratory, where sperm with the best motility and morphology are selected for the ICSI procedure. If necessary, the sperm may also undergo a process called sperm washing to remove impurities and increase the chances of successful fertilization. Next, the injection of sperm. Using a specialized microscope and micromanipulation techniques, a single sperm is carefully injected into the cytoplasm of each mature egg. This is done using a thin glass needle called a micropipette. After the injection, the eggs are placed in a special culture medium and incubated in the laboratory. They are monitored closely to observe fertilization, which typically occurs within 12 to 24 hours after the injection. Next, the embryo transfer. Once fertilization is confirmed and embryos have developed, one or more embryos are selected for transfer into the woman's uterus. This is usually done 3 to 5 days after the egg retrieval. Any remaining viable embryos may be cryopreserved or frozen for future use. Lastly, the pregnancy test. Approximately 2 weeks after the embryo transfer, a pregnancy test is performed to determine if the treatment was successful.
Next, we will be looking at the fatwa of fertility treatments in Islam. The first fatwa on fertility treatment was issued in 1982 by Al-Azhar University after the successful birth of the first IVF baby was reported in the newspaper in July 1978. The fatwa issued is that IVF is allowed as long as it is performed between a husband and a wife. Additionally, scholars such as Sheikh Mustafa Zarqa and Sheikh Dr. Muhammad Said Ramadan Al-Buti explained that in principle, fertility treatment is permissible since it can be considered as daruriyah, which is extreme necessity or vital interest. Subsequently, let's look at the fatwa of fertility treatment issued in Malaysia. After a conference was held in 1982, it was decided that in vitro fertilization is valid, or in other words, halal or permissible. It is important to note that IVF is only permissible between a married couple. That is, the ovum and sperm are taken from a husband and wife after they are married. It is not permissible if the treatment is done before the marriage. Additionally, IVF is not permissible if the sperm of a husband is used after his death. Most importantly, a baby born through test tube method can be a wali and is entitled to receive inheritance from the rightful family. Unfortunately, however, the fatwas are general in nature and only touches on IVF as a representation of other fertility treatments. It did not explain on each procedure or even on the state of the drugs and medication. To conclude, patients seeking to undergo fertility treatment are advised to consult an expert in both the medical and the religious field to see its compliance to Sharia. Infertility has been depicted in the Quran through the stories of our beloved prophets ﷺ. Let's take a look at two of them.
The first illustrates the story of Prophet Ibrahim alayhi salam and his wife Sarah, as revealed in Surah Al-Dhariyat, verses 28 to 30. Prophet Ibrahim alayhi salam's wife, Sarah, was old and infertile. This was mentioned in verse 29, Ajuzun Aqim. However, in the following verses, the angels of Allah subhanahu wa ta'ala delivered a good news to Prophet Ibrahim alayhi salam, which was a son. This came as a surprise to both Prophet Ibrahim alayhi salam and his wife Sarah. As with the example of Prophet Ibrahim alayhi salam, Prophet Zakaria alayhi salam's wife was infertile. Prophet Zakaria alayhi salam made a dua to Allah to grant him a child. This dua can be found in Surah Al-Anbiya verse 89. The dua is, Rabbi la tadharni fardan wa anta khairul warithin. It can be practiced by couples if they are planning to have a child. These examples show that being infertile does not make one any lesser a man or woman. Similarly, it does not make one any lesser a Muslim. Like Prophet Zakaria alayhi salam and Prophet Ibrahim alayhi salam, one should beseech Allah for the blessings of offsprings and continue to raise in doing good deeds.
The next one is ways to increase fertility. While there are some similarities in the general approach to improving fertility in both women and men, there are also important differences due to the distinct biological processes involved in reproduction. Some of the common strategies to increase fertility in both women and men are manage stress, get regular exercise, and eat a balanced diet. First of all is manage stress. The high level of stress can impact fertility in both women and men. So, stress management techniques like exercise, meditation, or counseling can be helpful. The next one is get regular exercises. Regular physical activity can help to improve fertility in both men and women by promoting overall health. And the last one is eat a balanced diet. A nutritious diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can support fertility in both men and women. However, there are also specific strategies tailored to each gender. For women, first of all is track ovulation. Women can track their menstrual cycle and use ovulation predictor kits to identify the most fertile days for conception. The next one is maintain reproductive health. Regular gynecological checkups can help identify and treat any issues that may affect fertility, such as polycystic ovary syndrome, PCOS, or endometriosis. And women can also consider fertility treatments. Depending on the underlying cause of infertility, women may explore options such as fertility drugs, intrauterine insemination, IUI, or in vitro fertilization, IVF. Men, on the other hand, they could avoid overheating their testicle, because prolonged exposure to high temperatures such as from hot tubs, saunas, or a tight underwear can reduce sperm production. Next point is, men also can limit exposure to environmental toxins. Men should avoid exposure to chemicals, pesticides, or other environmental toxins that can affect the sperm quality. And the last one is, men can consider supplements, as certain supplements such as zinc, vitamin C, and coenzyme Q10 may help to improve sperm quality and fertility in men.
In conclusion, although infertility is a complex issue that affects millions of individuals and couples, advancement in medical technology provide promising treatment. In this video, we introduce to you intracytoplasmic sperm injection ICSI, which is a treatment that's suitable for cases where the husband has oligospermia or abnormal sperm motility. Infertility can be caused by various factors including lifestyle habit. Therefore, adopting a healthy lifestyle is essential for addressing and potentially reducing infertility. In Surah Al-Baqarah verse 30 and mentioned, O Muhammad, when your Lord said to the angels, Indeed, I will make upon the earth a successive authority. The authority in this verse means Khalifa. So, it is important for us to have children and nurture them with values of a Khalifa, so that each generation ensure the ongoing fulfillment of this responsibility. This ties back to the verse in Surah Al-Baqarah.